Daniel Sanderson from the Telegraph.
Thank you, First Minister. Can I just ask about the issue of dentists, which is reported in the Scotsman today? Is it acceptable that people who can afford to go private are able to get things like fillings while people who rely on the NHS can't? And if not, what do you plan to do about this? And also, can I just ask Professor Leitch about the sort of spike in cases on Friday and Sunday? You mentioned that quite a lot of these cases were asymptomatic in the care home, and I just wondered if you could expand a bit on the significance of that and how that might affect things going forward. Thank you.
Okay, I'm going to hand over to Jason on both of these points. I think the position in dentistry is not quite as characterised there, but Jason has more expertise in dentistry than either of the other two of us here, and then he can give his views on the asymptomatic nature of some of the cases.
Finally, a piece of the puzzle I actually understand from having worked in it over the years. There is a difference between dental provision in different places, but the Chief Dental Officer has a very clear route map back to full dental care, different timings from the route map that you hear us talking about all the time. Emergency dental care and drilling, just as you described, has been available on the National Health Service, but it's been available in about 70 or so urgent care centres spread throughout the country. So a dentist has been available on the phone and now in person from today, doing routine care, dentures and orthodontic braces and checkups and other elements of care, and then moving from there to an urgent care centre if that's required. And Tom, the Chief Dental Officer, working quickly to move to the next step of the route map, which would allow aerosol generating procedures to be done in the thousands of practices. We're slightly more concerned about the aerosol procedures, of course, because of the nature of this virus. I wrote with Tom to the private dental practices in the country and asked them very clearly to follow the same route map out as the National Health Service dentists. We have slightly less control over what they do because of the nature of the contracts and the market in which dentistry works. But it was very clear advice that they would follow the same as the National Health Service. So care has been available and it is coming back to full dental care. The Friday and Sunday
around 2 o'clock as normal. Gina Davison from the Scotsman.
Hi, thank you, First Minister. The question really is for Professor Leitch. Just going back to the dentist issue, given what you said in your answer to Dan Sanderson, are you suggesting that private dentists who you've written to and who are now doing routine procedures with aerosol agents are going against your advice, and are they putting patients in some kind of danger if NHS dentists are not allowed to do these kind of treatments yet? And also, can I ask, in a kind of similar vein, why sports massage therapists who work with people in pain are not allowed to resume work when physiotherapists are working, and now even beauticians who might offer some kind of massage are able to work? I know that the regulatory body for the sports massage therapists believe they're being discriminated against and that your communication and consultation with them has been poor. So I just wondered what you might have to say to them.
So dentistry, I don't think is putting anybody at risk. Dentists are very, very well trained in infection and prevention control. They work in slightly different ways according to which piece of the dental puzzle they work in, but I know they all have adequate PPE, they are inspected appropriately, so I don't think patients are at risk. However, coming through the route map to the recovery of the National Health Service, we have set in place some guidance for optometry, for podiatry, for dentistry, and we asked in my letter with the Chief Dental Officer and others that the private sections of our healthcare system, including our private hospitals, followed the same pathway out as the National Health Service. So that guidance is there and people can read it. Tom, the Chief Dental Officer, is very keen to get National Health Service practices back just as soon as we can with the full gamut of care.